Good morning. It is Thursday, September 19th. As promised, I'm going to make a video. This isn't the video I promised a few weeks ago regarding update on my surgery and any questions you had, but it's a different update. It's the update about the fact that I've been yammering on about my thighs. Last November, I had round one of my excess skin removal. I had a 360 body lift with muscle repair. I had a breast reduction with lift for round one, and then round two was supposed to be strictly an arm lift and a thigh lift. And both of them are supposed to go all the way to either knee or elbow, and that's what I had always wanted. So if you have not been following round two, I got there and Dr. Campbell, because I went to Premium Care Plastic Surgery in Cartagena, Colombia, who is an American board certified plastic surgeon, board certified in America, because he is American. He talked me into doing a mini thigh lift. He's trying to talk me into a mini arm lift. I denied that. And I ended up paying an additional $750 and got a BBL, about 600 cc's in both cheeks. I'm glad it's deflated. I could barely get my pants on. I mean, it looked fine, but it's just, I want to get my pants on. And I got some lipo. Not much lipo because there's not much to suck. And because I did the mini thigh lift instead, he lipoed my inner thighs. So round one, I had actually requested that they lipo my arms and lipo my thighs. He said no, because he can do that on surgery number 2, which was February, by the way, of this year. It turns out, which I did know the day before, a couple of days before the surgery, at that physical consult, he would not be doing arm lipo because after visit number 1, there was a patient of his who had a healing problem, and he doesn't do that anymore. So I didn't get that lipo. He was supposed to lipo at the tricep area. And then for the full medial thigh lift, he doesn't lipo the thighs, which is why I was trying to get him to do it the first time. Because he made it sound like the result would be like not good if he did a full medial without lipo. It's like they're setting it up for you have to go back the third time. And I only wanted 2 surgeries. I'm not trying to make my body completely perfect, but I am trying to remove the excess skin I've dealt with. And because I am a runner, I see the results of the excess skin, like literally, like in photos. You can see it moving and clapping. It's just disgusting. But 6-9 months later, I'm adamant. I do not like my thighs. I want them redone. We had been in communication. I supplied them photos. He kept talking about how they can do a relift. And up until yesterday, when I had sent an email requesting, I finally get this quote, everyone's saying I can get done for this thigh lift. I may have pointed out some business flaws. I believe because I came home with less money than I spent and less money in my bag, that there may be a thief amongst us in the Premium Care Suites. I did tell him whom I thought it was and why I thought it was, because on visit number 2, my bag that was on the floor in the far back corner of the closet that I had arranged so I would know if someone touched it was touched. The other patient who was there, I had told her prior to this day that I thought that had happened. So when I saw that it had moved, I talked to the person. Said, so why are you going through my bag, And I'm like, I think you took money from me last time. And yeah, she said something in Spanish and she kind of laughed. I don't know, obviously, what she said, but that was it. And prior to her being my person, I had actually implied to the suite manager that I didn't really want her around, and I kind of implied because there's reasons. So interesting, right? Yeah, so that was one thing I pointed out, and then I also pointed out that the suite manager I don't think likes me, like at all. The treatment I received, besides being able to sleep in the better room, was way different from visit number 1. And then additionally, when I was leaving to come home, I never even saw her. She never said goodbye. And I know she was in the building actually because my suite mate, she's like, oh yeah, she said goodbye to me and hugged me and this and that. And I'm like, yeah, she hates me. And actually, the other patient, she didn't think that was so cool because we kind of talked about that at the airport as we were both waiting for our flights. So I'm not imagining it. Anyway, so these are some of the little critiques of premium care I had mentioned in my email. It's not that I didn't think Dr. Campbell was going to get it, but I wanted a quote for this medial thigh lift revision that everybody was like, yeah, we can do that. Suddenly, after that last email, right after the patient coordinator, Andrea, had emailed me saying, oh, I'll check with the surgeons about price, Dr. Campbell, like 2 minutes later, emails me and saying, yeah, I've re-reviewed your communications and your photos, and you don't need additional surgery at this time. So I didn't get ghosted like I thought, but I basically got fired. Yeah. So I still have excess skin on my thighs. I'm not happy. I wanted the medial thigh lift. I was talked out of it. They're not going to fix it, obviously. And I'm going to have to go some different route. As I'd mentioned somewhere, I have gotten a quote. It was more than I wanted. And because I'm kind of down on a running injury right now, is the only reason why I was thinking about it sooner than 2+ years out. So emotionally, I'm distraught. Mentally, I am pissed off and distraught. And this is embarrassing. I mean, I can't run with shorts. And that was not the point of spending all this money. I was supposed to get the 360 body lift, the breast reduction, arm lift, thigh lift. That's all I wanted. And I kind of came out there 80% complete and 20% incomplete. So that's my update. I'm going to do the other update, trying not to be biased regarding my other stuff. But do I recommend them? Yeah, if you don't have anything that is like difficult. Safety-wise, I mean, I can't say they're not safe. Personality-wise, apparently if you're a better person than I am, things might work out better for you. But that's neither here nor there. I do know that a couple people had followed me who had got consults for premium care, did not end up going with premium care. I am kind of interested if you did that because of price or just because you didn't like them. But, I'm not calling you out. But obviously right now, I'm a little burned. So have a good day. Bye.